Hello world, my name is Dr. Kundlas and I'm primary care physician. Since COVID-19 pandemic, there has been a lot of strong emotions about safety, efficacy, and above all the need of different vaccines. What if I tell you a single shot of these vaccines can really prevent you acquiring this disease, and if God forbid you acquire it, getting it hospitalized and definitely preventing death. These are the three cardinal rules about any kind of vaccine. Number one, how effective it is in preventing the original disease. Number two, how effective it is to prevent hospitalization. Number three, how effective it is to prevent death. I have compiled 15 of your most common questions. In this video, I want this information to serve as your guide, and I will update if there is any change in coming years about the vaccines. What vaccines do seniors above 65 need? There are four primary vaccines. Everybody should have flu vaccine yearly. Number two, pneumonia vaccine or pneumovax at least one time above the age of 65. Number three, RSV, recently approved above the age of 65, and it is a one-time deal. Number four, COVID-19. Everybody should get herpes zoster or shingles vaccine. It comes under trade name Shingrix, and also Tdap, diphtheria, tetanus, and pertussis every 10 years. Everybody should have these essential vaccines. These vaccines are highly effective in meeting all three North Stars. No vaccine is 100% protective. If they can lower any of these, they are effective. Above all, the vaccines are very rigorously tested, and even minor reaction happening out of these vaccines are counted against them. In general, these vaccines are very effective. Just imagine now, it is a good time to be a senior. You are covered against flu, pneumonia, RSV. These three are the main winter diseases. And the COVID vaccine is definitely highly effective. All seniors should get flu, pneumonia, RSV, COVID. If you're traveling, additional vaccines you should consider typhoid and yellow fever. What is senior flu shot? As we get old, our immune system gets weaker. It needs extra load antigen to make it work again so that it produces a robust reaction against antigen which is given to you in that vaccine. And we accomplish that by two ways. Number one, in some cases, we give you 4 times the dose of a standard flu shot, and in certain cases, we add a adjuvant chemical which also stimulates your immune system. All the seniors should insist on getting senior flu shot either with high dose of antigen or with adjuvant. That will lead to proper immune response so that you are protected. RSV vaccine is recommended for seniors above the age of 60. Anybody who has severe lung disease like COPD, heart failure, or they are immunocompromised or they are on certain medication should consider taking RSV vaccine. Now we have three options. We have RSV vaccine made by GSK. We have another option produced by Pfizer. And now Moderna has also filed paperwork to FDA regarding messenger RNA vaccine. So we will have three vaccines. RSV starts as minor cough and cold, and 90% of the cases is very self-limiting. But if you have lung disease, you're immunocompromised, or a heart disease, and anybody who is generally accepted by a physician to be high risk should consider taking RSV vaccine. These vaccines are one-time shot, one time and you are done, and they are very effective in meeting those three North Stars. Above all, these medications are very safe. 1.5 to 5 cases, there was a concern about a neurological condition, Guillain-Barré syndrome, being at increased risk. In all the study, the incidence is 1.5 to 5 in 1 million, meaning 1 to 5 people can develop this neurological complications if 1 million seniors get this vaccine. This, by all standards, is considered very, very safe. Initially, there has been some reports that some people get increased risk of irregular heartbeat like atrial fibrillation after you get this vaccine. Now we know for a fact if we take RSV vaccine alone and do not combine with other, the incident rate is very slow. We should consider this vaccine strongly. How often should seniors get pneumonia shot? Pneumonia shot is one time before the age of 65 and one time after the age of 65. There has been 3 vaccines, PVR 15, PVR 20 and polyvalent 23. These are 3 different kind of pneumonia vaccines which has been approved. If you have gotten PVR 20, then you need only that. If you are taking PVR 23 and PVR 15, that combination is equally effective. This vaccine has a very good acceptance rate, more than flu shot, more than COVID shot, and more than RSV shot. And in some estimates, it's about 70% of seniors have one time in their life pneumonia shot. What are the side effects of single vaccine in seniors? Shingle vaccine can give you a local reaction when you get it. Most of the time, people complain of mild chills, achiness, and low-grade fever. Serious complications are very, very rare. Everybody above the age of 50 should have 2 injections, 6 months apart. And if you have previous shingle vaccine, you need to get repeat 2 shots. Even if you have shingles disease itself, after a certain time, it is recommended that you should get singles shot. Should senior get high-dose flu shots or regular during flu season? As we get old, our immune system goes down, and it is recommended that seniors should get high-dose flu shot, and they should avoid taking regular flu shot. The logic behind is these high-dose flu shots have either high dose of antigen against flu, or there is another adjuvant chemical which leads to better immune system and you are better protected. Can seniors receive multiple vaccines at the same time? This answer is yes, generally. But when RSV vaccine come in, it was recommended to take RSV alone, and other combinations have been considered generally safe. Is shingles vaccine safe for seniors with heart disease or diabetes? Absolutely, because diabetes and heart disease put you at higher risk to develop shingles. And the most deadly complication is post-herpetic neuralgia. This is a complication, the place where you have shingle, that nerve gets permanently irritated and give you a lot of pain and suffering. And shingles vaccine is 90% effective in preventing post-herpetic neuralgia. Does seniors need COVID-19 booster in 2025? Anybody who has gotten last year 24-25 booster, they are covered. We need to always wait for CDC's updates as this virus mutates very quickly, and we must keep up with the latest CDC recommendations. There is no way somebody can give you a blanket answer to this question because recommendations will change based on when you are listening to this video. What is the difference between PCV 20, PCV 15, and PPSV 23? Pneumococcal pneumonia, the bacteria which give you pneumonia, it has multiple different kind of surface antigens. In PCV20, we have developed a vaccine targeted against 20 different those antigens. The PCV15 vaccine has 15 antigens, and polyvalent 23 has 23 agents. Most tried is polyvalent 23 vaccine, which has the most data. But You could take PCV20 alone or combination of PCV15 and polyvalent 23. They both are effective and can be used in any combinations. Our senior vaccines are covered by Medicare. Yes, they are very well covered, and now beautiful part is these vaccines are available at your pharmacy. We in our offices have stopped giving patients these vaccines to maintain proper chain of command. It's difficult and smaller practices have difficulty in maintaining that. I recommend you should go to one of your chain pharmacies like Walmart, CVS or Walgreens, and you should get those vaccines free of cost. When seniors should start getting their vaccines updated? The answer is today. Other than flu shot, pneumonia should be given today. If you have not received it, you should get RSV, you should get single shot, you must update Tdap. You should wait for the guidelines on COVID-19. How effective vaccines are in people above the age of 70. Older you are, you may need higher dose, like as I went over, you may need senior flu shot, but they are very effective at any age. And older you get, there is a more need and you are more vulnerable to these diseases, so that's why you should get it. Do vaccine interact with medication taken by older adult? Most of the time, these vaccines do not interact with the medication taken for most common diseases like hypertension, diabetes, cholesterol, antidepressant, pain medications. Immunosuppressive therapies like steroids, chemotherapies, and other TNF inhibitors, which we use for different autoimmune diseases or immunological diseases, can decrease the efficacy of these vaccines. Blood thinners like warfarin, they noted to have some local interaction, like when you get a shot, you may have increased bruisability, but there has not been any adverse effects. No adverse effect has been reported. Is it safe for seniors with autoimmune diseases to get vaccine? Yes, inactivated and recombinant vaccines are safe. The live or live attenuated vaccines like MMR, they should not be taken. These common vaccines, influenza, COVID, RSV, shingles, pneumonia, they all are safe. People who get frequent flare up of this immunological disorder, they must get these prescribed medicines. The recommendations are seniors with autoimmune diseases should not skip these vaccines. In fact, they are at high risk to develop complications. I hope I have answered most of your questions. Please like, share, and subscribe to our channel. Please do write your comments. I know vaccines sometimes provoke very emotional responses. I will be answering your questions based on evidence. Imagine that you have been properly vaccinated. You will be able to function the communities. You could protect others from getting sick. If nobody else, your spouses, your friends, your children, your grandchildren, it is prudent to get vaccinated. Thank you.